for doing it. Let me just say a word as they're coming up on stage. May I call you Tunde? Do I get away with that? Welcome. As they each come up on stage, let me just say that Bono, the rock star, when he was here in Nigeria a year ago, he was meeting with Mr. Dangote and others. Let me just get the quote of what he said, because he said that the young people of Nigeria are like rocket fuel. There are no limits to how far they can go. They can transform the continent, or they can blow up in your face. Harnessing their energy, every parent in this room knows what I'm talking about. Harnessing their energy requires investment in their education, their employment, their healthcare. And so we are going to talk this morning a little bit about that investment in each of those areas. But bear in mind that the ultimate goal are individuals who can realize their full potential and make their full contribution to the continent that is Africa. We'll do this in a little bit of order. We're going to be out of order because we don't see Toyin and Saraki, but we're going to do it in order of chronology a little bit. We're going to focus on children early, in their early days of life, ensuring that they have a healthy start. We'll talk to Minister Werner about education, the key mover to helping everyone reach their potential, and his focus on improving student outcomes. We'll talk to Mr. Aigboje about employment, and then finally we will talk to Dr. Moyo about the infrastructure that is needed to make all that happen. So, Minister Werner, we're going to start with you. First, if you would give us a sense of the nature of the problem in Liberia when you came in to take over this role. Perhaps talk about the number of kids that are in primary school, the number of folks that are literate, or the nature of the problem you sought to solve, and then we'll talk about how you solved it.
Well, thank you very much to the African Philanthropy Forum for the invitation. To go straight to the issue, Liberia has a population of around 4 million. So that's a very small population. And I have been Minister of Education for 2 years. Before then, I was head of the public service. And my task was to rehabilitate the entire government post-war. And over the past 12 years, we have grown access by around 1.5 million. Thank you. Yes. At the primary level, because of President Sirleaf's leadership, we emphasized that all kids should come to school, but placed more emphasis on girls' education. So at the primary level, we just about closed the gap between girls' enrollment and boys' enrollment, 49 to around 59%. We also realized that when we did the assessment, that 35% of young women and 21% of young men could neither read nor write. And in rural Liberia, it was worse. It was around 27% young women and 58% young men. When I looked at this, I thought, yeah, we have a problem. And so this is, in short, the situation I found when I went to the Ministry of Education to be Minister of Education.
You had been a school teacher in 5 different countries, including Liberia. But your goal was not only to improve the quality of teaching, but the bottom line is improving the outcomes, the educational outcomes. You entered in some interesting partnerships, and I want to start with the one with, in particular with Bridge Academies, but there's more than that. It's all about creating what we call charter schools, in essence, in the U.S. So talk about that partnership. What are its characteristics, its attributes, and is it working?
So yes, as you pointed out, I came to the ministry having worked here in Nigeria as a teacher, in Abia State Maris Comprehensive Academy, in South Africa, sometime in Zimbabwe, in Kenya, and the US. And so I had a background in teaching. So what I saw allowed me to think differently. Liberia, because of a 14-year civil war and Ebola, is pretty behind its counterparts. It wasn't like that before, but that's where we are. And I needed to figure out a system that would not just leapfrog Liberia into the future, but that would improve access to quality in an accelerated way, taking advantage of the advances we had made, not just in teacher education, but in technology as a whole. And as previous speakers pointed out, it occurred to me that to do that, we needed to form a public-private partnership. Now, people carry that as Liberia privatizing its entire school system. No. What we wanted to prove, using philanthropic giving as a catalyst for change, was to bring together proven private providers, combine them with government policy, creating the right environment, so that they could do what government, as somebody said earlier, in my view, is incapable of doing. I don't know anywhere in the world, perhaps maybe for Vietnam, that governments are competent in educating poor kids. I've never seen it. And so we went on a hunt, looking for proven private providers with the credibility to partner with the government of Liberia to improve in an accelerated way learning outcomes for children. We found 8 of them. Bridge International Academies, Rising Academy, Street Child, More Than Me, and there were some that were indigenous to Liberia, Stella Maris School System and the Liberian Youth Network. We contracted them to improve management systems in our schools and gave them, in the first year, 93 schools. And we said we need these deliverables. We need teachers to be showing up. We need learning materials in the classroom. We need students coming to school every day and giving extended instructional time. We need parents participating in the learning processes of their children. Help us deliver that. They said, okay, we can do that, but you may need to increase your per pupil costs. At the moment, Liberia has one of the lowest, if not the lowest, per pupil cost in sub-Saharan Africa. $50 per child per year. That can't do you anything. So what we did, again, through philanthropic giving, was to raise an additional $50 to $60 per child, giving it to each of the partners to improve learning outcome. Over the past 2 years alone, through philanthropic giving, we've raised around 10 to 15 million to reach close to 70,000 children, and there are no fees. Teachers are showing up. There are no more empty classrooms. There are learning materials. And on top of that, we instituted, one of the things, and we'll talk about this maybe, is many people in the world of philanthropy have worked hard for their money. They want to see the impact. And when you are in government, the perception is that you cannot manage money well. Government is easily branded as corrupt. And so what we did was to prove impact by contracting an independent evaluation of the program to provide evidence. And that evidence is out. It shows that children in these schools, in the partnership schools, are learning 60% more than their control group counterparts. So this is the kind of work we've been able to do in the last 2 years, catalyzing change through philanthropic giving.
So with these results, with these outcomes, you would expect this pilot to take off and ultimately encompass the entire school system. But aren't you at an inflection point right now? Tell us where you stand right now.
So it would be nice, and I know there are journalists in here. Tisi was kind enough to give us the statistics on the continent. Where she comes from, Zimbabwe, arguably had one of the best education systems in Africa. It probably still does, but when I talk to my counterparts, and even those who set up the system, Zingai, they tell me Zimbabwe is sleeping. That story is true for all of Africa and the developing world. Populations growing, budgets are shrinking, commodity prices are falling, and so governments are struggling. No government, whether you have oil or gold, is able to fund public education at the level it should be funded to achieve the desired outcomes. A partnership, therefore, with the private sector is a necessity. We, in Liberia, we believe we are providing a model. It's not perfect, but we are providing a model that other governments can look at. If I had my will, thankfully, President Sirleaf is abiding by her term limit, and she will not run for a third term. So my time as a political appointee comes to an end in January. But if I had my will, I would increase private sector partnership for improved learning outcomes in Liberia. Now, you do so at a peril to your own reputation, because the system is being protected by entrenched interests, including teachers' unions. I don't have any, I've been a teacher myself, but teachers' unions often take care of their own interests. Nobody's asking what the child is learning. So we are at a point now where we are consolidating the pilot year, reaching areas where we never reached before. We are at a point where we are thinking, given the impact the first year has had on the entire school system, using what we learn to cascade the lessons for the wider public school system, how far do we want to go and at what scale? I believe Liberia will scale. And if it means using a development impact bond to scale, we will take that route to do so.
But this is an area where philanthropy can play a role. In your first year, was the funder Optimus, UBS Optimist? Or
so there are many funders in the room. We pulled together a coalition of funders. I think I'm at liberty. Elman is here. UBS Optimus, Vito Foundation. There are many others that came together. London being the capital of the philanthropic world. And we were able to put together substantial money to see this happening. I believe that when there are leaders in the public sector system that are willing to champion change, when the world of philanthropy supports them to catalyze that change, it would have a bigger impact, not just for what they are trying to change, but for the wider continent. So we thank you very much, all of you here, who have, in many ways, given money to this project to succeed.
You know, often people fear, that when private sector managers come in to manage a public system, the public purpose is gone. That is not the case. These are schools that take all comers. They're not exclusive. They're for young Liberians. This is an opportunity with a very small investment to take the cost of what will pay for their education from $50 to $100. Let me say it's $7,000 in the US. So this is not hard to meet. And this is an investment in the future. So I don't want to be an advocate, but I do want to congratulate you on all you've done and hope it will continue. So let me turn to you, because sort of problem number one is providing the level of education, not only access to education, but quality education. And part of that is readying them for the workforce. You're taking on the problem in Nigeria, particularly in Lagos, of unemployment, in particular youth unemployment. So tell us the nature of the problem first, and then we'll talk about your solution.
So thank you very much. So I think to situate the conversation correctly, I personally believe Nigeria has got an unemployment crisis. Overall, as a country, we have 35% of the working population either unable to find work or struggling within an underemployment category where the quality of work that's available isn't commensurate to the skill levels of the people. Now, the youth unemployment crisis is even worse. So today we have 49% of all people under 35 either struggling to find work at all or struggling to find work commensurate with their skills. Now I listened to the minister say, and with all respect, Minister, that Liberia has got 4 million people. But the youth unemployment problem in Nigeria has got 18.5 million people. So it's important to understand the context of how many people under the age of 35 are just unable to be involved in productive activity. So this is the disease, and the symptoms we've now seen manifest, whether it's in ethnic crisis, whether it's in insurgency, it's in insecurity, etc. The fundamental problem is that you can't have 20 million people within one country unable to find work. Now that's the problem. The first part, and I think this also speaks to part of the solution. The first part is, as at today, we're even unable to disaggregate that problem at sub-sovereign level. So the numbers you get from a statistical point of view are national numbers. So if you ask me today to say, what's the Lagos story? I'll give you anecdotal evidence, but there's really the hard facts to plan properly isn't available. So the real problem for us is, one, we see that the levers for creating jobs don't exist. Job creation will come primarily from the private sector. Access to finance remains a fundamental problem for businesses, especially small businesses, who are the real engines of growth. So if you are borrowing today at interest rates north of 25% per annum, even if you are successfully able to repay that debt, there's simply no capital to invest in growing the business and therefore employing more people. So that's the first problem. The second problem is also that when you speak to employers, there's a mismatch between the available skills and the job opportunities. So we have situations where employers will say to us, we have the capacity, and I know some private sector employers who say to us within the next 2 to 3 years in Lagos, we want to hire 60, 70,000 people, but we don't know where they're going to come from. When we go into the communities we operate, we find people with poor attitudes, very limited skill, and it still boils down to how they're being educated. So the real challenge I think we're facing is, how do we shift the mindset from what is effectively a white-collar employment mindset to growing technical and vocational education? So that's one of the problems we are facing in Lagos. But we've also realized that no matter how much government puts, government funding is simply insufficient to solve this problem. And I think the minister has made the point very clearly about, declining revenues and the quantum of the problem just getting bigger. So for example, within the Lagos state government, we have a fund where the state government has seeded 25 billion naira over a 4-year period. We're in our second year, and we're fully drawn on government capital. And we've barely enough, in the first 12 months, I think we provided single interest loans to approximately 6,000 businesses. We're training now across various technical and vocational courses, approximately 10,000 people. We're doing some work investing in early stage innovation-driven enterprises. But we're finding very quickly that we're spreading ourselves too thin. 6,000 SMEs is a handful in the size of the SME opportunity in Lagos State. So it's important that, and I think the minister made the point very well, that there's the perception that government is at worst corrupt and at best wasteful. So one of the things that we are also very strongly focused on is the independent assessment of our work, to be able to demonstrate credibly that this work is impactful and therefore find partners to support that journey. So I think to summarize, the first thing is that the quantum of the problem is simply too large for governments to solve alone. And it's also the realization from both sovereign and sub-sovereign governments that you can't act in a carefree manner anymore. You need a lot of help, you need a lot of support to even think about the solutions to this problem before even executing. And so government can't sit in a silo and create solutions for private sector operators who are really your levers to improve job creation across the continent.
As you think about both job training and about entrepreneurship, is there any particular emphasis on women in that calculus?
For us at Lagos State Employment Trust Fund, it's a very women-first philosophy. And this is because generally the cultural framework for entrepreneurship, for asset ownership, has vested a lot of power with men. So women historically have been significantly disadvantaged. Now, our fund has a target to ensure 50%, at least 50% of all our loans are given to women. 50% of all our technical and vocational training programs are focused on women. Today, I think we're at 42%. So, it's not quite there, but definitely. And I think the more interesting part is from our repayment numbers today, women are significantly better borrowers. So there's a 4% difference in the repayment performance between men and women. So for us, that's significant. So there's an economic case for it, apart from the social case.
I'm going to turn to you, Dr. Moyo, and talk a little bit about it. In the African Development Bank, you've got the broad view. You've also worked at the World Bank. You're a trained economist, a PhD in economics. Your view has to be broader. You have to understand the whole picture, and then the narrow investments within that picture. Education. If Toyin were here, she'd say maternal and child health. Tundi is entrepreneurship, training. As you think about the priorities that your member governments face, what does that look like?
Thank you, Jane. Thanks for having me, and good morning, everyone. So yes, I'm coming from the African Development Bank, and there is a phrase or an approach that we have coined, and we call it co-development. And we call it co-development because, the challenges of, economic development and more importantly, socio-economic transformation are just getting bigger and bigger, and the realization is clear that no single institution, entity, organization, government can do it on its own. So the whole idea behind co-development is really just working together. In this context, it's really optimizing that intersection between, public policy, private wealth, civil society, or action or activism, and so on. So let me just give a little bit of my experience, from when I headed the One campaign in Africa as a civil society organization in Africa, and how, what I learned about philanthropy really, and funding for civil society organizations. There are two types of philanthropists, essentially. Those who love what you do, and are going to fund it are going to get behind you, and those who want to drive the agenda. Either way, both are, game changers and influential in terms of, working for development. In terms of the role for government, I think, very specifically, in terms of the government promoting philanthropy in Africa, it's really about creating the policy environment, a favorable policy environment. In fact, I like to call it a sympathetic legal policy tax environment around charities, around donations, around fundraising, the whole sort of infrastructure. And don't get me wrong, a more favorable tax and legal environment does not necessarily mean that it will lead to greater philanthropy, but it does signal the understanding and appreciation of the importance of philanthropy, and that's always a good place to start. So what is needed, I think, from all of us here, depending on where we're coming from, is to really begin to do the advocacy for philanthropy. The advocacy around philanthropy, I think, is very important because that's how we're going to get to the next step and to the next level. But on the part of civil society as well, it's important for me to say this. Civil society also needs to, in a sense, demonstrate the proof of concept. As civil society, I think we need to be more accountable as well, in addition to holding others accountable. We also need to show the value proposition of the work that we do, because even if government creates the sort of sympathetic environment, if the cultural perception of civil society is not favorable, or there isn't enough confidence for what civil society does, then the potential local philanthropists will not come to the table. They will still be far away. So it's really, there's an important intersection for all of this to come together in order for it to really work. But government does have an important role to play in terms of just creating the right environment, legally, in terms of taxation, regulation, and so forth. And from the African Development Bank, really, as I said, we're taking a co-development approach, and that means we're learning to work better with civil society. We're learning to partner with foundations, and other donors, because the agenda is huge. And, let me just make this pitch. Some of you have heard of the high fives of the African Development Agenda. And this is, they really capture the development agenda for Africa that is needed to achieve transformation. We talk about Feed Africa. That's really about transforming agriculture so that we are creating jobs and business opportunities, feeding Africa, across the value chain. It's not just about farming, but everything, packaging, exporting, and so on. We talk about Light Up and Power Africa. We're not going to run industries or transform agriculture or anything else without electricity. 2 days ago, we were running a fashionomics masterclass for young people in Nigeria who want to go into the fashion industry. And all of them, as they were making their pitches, said they need funding so they can buy a generator. There is nowhere else in the world you will hear that sentence. I need funding so I can buy a generator. So, electricity is really important, and the cost of doing business is driven up so high in Nigeria because of the lack of electricity. So this is really an important agenda. We want to flip the numbers from 20% of Africans having access to power today to 20% of Africans needing access to power tomorrow, so that we really have all Africans getting electricity. So I wanted to say that, to achieve all these things, we'll need everybody to work together. And I think we need to really start advocating for the role of philanthropy so that it has a favorable environment to work in.
And another key infrastructure element is connectivity. I mean, Tunde is trying to promote new businesses. That makes all the difference.
Yes, absolutely, absolutely. Infrastructure is key, you know, and for us, infrastructure comes very much under our integration agenda, integrate Africa, because you need, you know, all you know, aspects of infrastructure, from communications to roads, rails, air, you know, and so that's really key. Education, health, you know, so there's soft infrastructure, hard infrastructure, and we're not going to achieve development without infrastructure. So, you know, the high fives in a sense are comprehensive. They really capture what needs to be done in Africa. The fifth high five, I've talked about Feed Africa and agriculture, I've talked about energy, I've talked about industrialization, which is the big thing we were discussing with the youth at the masterclass 2 days ago. I've just talked about integration. And last but not least of the high fives is improving the quality of life for the people of Africa. And that's really about investing in human capital, education, health, clean water and sanitation, you know, all of those things that we've heard from Tunde and the Honorable Minister. So infrastructure is absolutely key. Without it, we're really just, you know, tiptoeing around development, if I can put it that way.
So back to public-private partnerships just for a moment.
Yes.
You were very involved with AGRA, the Alliance for a Green Revolution in Africa.
Yes.
And to prove the connectivity point that Queen Sylvia made, Strive Masiyiwa, who's a distant relative of Tsitsi Masiyiwa, such as husband, is chair of the board of AGRA. Tell us a little bit about AGRA, its purpose and its success.
Okay, so I'm not sure that I can speak very much for AGRA, because I did attend the AGRA forums every year, but I've never been employed by AGRA. I ran the one campaign at the time that I was involved with AGRA, and now I'm with the African Development Bank. And my boss, the president of the African Development Bank, used to be vice president at AGRA and has just won the World Food Prize for agriculture. So the work that AGRA does is really important because it's about value chains and, you know, what is required to really transform agriculture. You know, they take in all of the research that's done in agriculture, the technology around agriculture, you know, so it's important work that they do, but I don't feel qualified to speak on behalf of AGRA.
So to keep those connections going, you were named by President Ajasina, who used to be not only the agricultural minister here, but worked at the Rockefeller Foundation. So we're all connected in the end. Her Excellency Toyin Saraki is here to join us, so do come up on stage. We started the conversation talking about the importance of youth to Africa's future. And so we wanted to cover basically the life. You're focused on prenatal, neonatal, the first 1,000 days of life. How do you assure that kind of health? Minister Werner has been focusing on education. Tunde has been focusing on employment. And Dr. Moyof has to focus on the whole ball of wax. So I wanted to start just to get a sense of your own philanthropy with Wellbeing Foundation, including the structure, because it's a group structure. But first, the initial purpose.
Well, first of all, good morning, everybody, and I'm really sorry I'm late. How can I really start? I started in an informal manner in 1991 because I had a terrible birth experience, and I realized about 15 years later that this was very, very common in Nigeria. And I had a very strong sense of social responsibility that felt that government and even individual citizens should be prepared to look after new lives right from the moment of conception, from birth to age. And it was very difficult then because even though Nigerians traditionally are huge philanthropists, I mean, I think any Nigerian in this room will attest to the fact that we all look after the people around us. But structured philanthropy was very, very new then. And I recall actually with a lot of amusement that in 2004, when I sent my lawyers to go and register the Wellbeing Foundation, the government, the Corporate Affairs Commission, kept sending the name back to me because they just couldn't understand why I was calling it the Wellbeing Foundation and not such and such a charity. So I kept getting letters back from the CAC saying, look, if it's a charity, tell them you're doing a charity, and what's all this nonsense about foundation? But I had to explain, in order to justify the choice of the name, that I was trying to create something that would not only advocate, but would actually move change in the value that our country, and when I say our country, I don't mean just government, I mean even ourselves, attaches to human life, and to try to find the best models for the type of investment to actually save lives at birth. And from our research, we have a 1,000-day model. So the 1,000-day model actually starts at the moment of conception to try to first educate the mother about what's going on in her body, to encourage her to seek financial inclusion, because for us, birth preparedness is more than just medicine. It's actually about being in the right place at the right time with the right information, and, to put it quite bluntly, the right money. And to access all of that, you need information, you need education, and you also need a heightened awareness of your own value to humanity. And the piece about it that a lot of people don't see is really the accountability piece, because there is no way I could have achieved what we've achieved so far, or even be able to plan, without the role of government. I think if I'm to really exemplify the role of government, the very first step that I took was in developing Nigeria's personal health record, because we had so many deaths, and culturally, we don't like autopsy. At the time that I started, 1 in 6 Nigerian women in 2004 were dying in childbirth. And if she's a Christian woman, it might take 2-3 weeks before she's buried. If it's a Muslim woman, she was buried the same day. So we actually had no idea what was really killing our women in childbirth, but I felt it was a national emergency. And I advocated very hard at every level, both to government and to the grassroots, the women themselves, that look, we can't just be accepting these deaths. We must find the reasons, and the way to find the reasons is actually to keep proper health records. I also am somebody who is not very keen on the usual donor-beneficiary narrative, because I think individuals can actually be helped to become their own civil society, community accountability mechanism. So I wanted to put that accountability both available to government, but actually in the hands of the actual women and their children that we were trying to save. And this has gone quite far since then. The health record I designed has been adopted at the front lines of public health in Nigeria. It's being run by government through primary health centers, which actually is where most of our lives are lost or gained. Since then, we then noticed the big infrastructural gap. It was one thing to advocate for women to give birth in equipped health facilities, and it was another thing for the woman to get to the health facility and be expected to bring her own supplies. Not having those supplies, you know, basic things, a navel clamp, an antiseptic, a sterile razor to cut the umbilical cord, actually kept a lot of women out of hospital. So we started what we called the Mama Kit. And it sounds a bit ridiculous, but we did this clean delivery kit, and I didn't invent it. I actually pinched the idea from the Red Cross, because they had been using it as a sterile home delivery kit. And we started giving it to women so that that would not be the bar for her to access hospital. Now the Mama Kit has been adopted, not just in Nigeria, it's been adopted by the UNFPA for use in IDP situations. But I would actually love to see, and this is one bit of advocacy to the government, I would love it. I think I will know I've succeeded when I never have to give another woman a Mama Kit, because the aim is that when a woman walks into hospital, that hospital should already have the supplies that it needs to deliver her safely. Am I good for time?
No. We've been talking about the interplay with, actually let me just say a word of how important this work is and how broadly it's needed. I've just come from a conference in which we were talking about the healthcare delivery in Kenya. And there, when a woman has a cesarean section or gives natural childbirth, she then shares a bed with another woman, not in hygiene conditions. And fortunately, Philanthropy has come through. 48 new beds have been designated, but it gives you a sense of how basic, how core, and how damaging over time this problem is if it's not solved. We've been talking, Toyin, about the interplay between government and the charitable and private sectors. You aligned much of your work at the very beginning with the Millennium Development Goals, broadly, and now with the Sustainable Development Goals. Tell me about that decision and what that translates into for you.
You know, the reason why I actually aligned with the MDGs was because when I wanted to help, it wasn't a case of woman or first lady just, wanting to be obvious. I had very, very high expectations for my citizenry, and I didn't really feel that going for low-hanging fruit was going to be the way to solve our nation's problems. So I actually searched far and wide to find what are the global goals, and then what are our problems on the ground, and what are the good things about the way we live and the way we operate, and then how can I translate those global goals with an easy platform that people can either partner with me or people can replicate. And when I met the United Nations Secretary General at that time, Ban Ki-moon, it was like a meeting of souls. And he had what I would just call a simple to follow agenda, which allowed me to be able to pick partners actually from all over the world, and not just as a platform for the Wellbeing Foundation, but for the movements that I was trying to create in country, because one person, can't save every woman alone. And that led me to the International Confederation of Midwives. Nigeria had at the time over 400,000 midwives, but they were clustered in towns and cities and not in the rural areas where we needed them to be. So looking at the global goals, I then approached the Federal Ministry of Health and the National Primary Healthcare Development Agency. And I said, look, we have trained midwives in this country. Most of the most experienced ones are already retired. Is there a way that we can bring them back into service and get them to the women who need their care? The cost of the salary of a midwife is less than half of the cost of the salary of a doctor. But a qualified, trained, educated midwife is a really safe pair of hands to guide a new life and to educate the mother. And this actually led to the midwife service scheme of the National Primary Healthcare Development Agency, where 4,400 midwives were brought back into service in 2010 and redeployed throughout the country through local governments level to the primary healthcare centers to deliver babies. Now, between 2010 and 2015, the impact of this program was so high that our survival rates went from 1 in 12 women surviving childbirth in Nigeria to 1 in 6 women surviving childbirth in Nigeria. So from the Wellbeing Foundation's perspective, we're quite small, but we have quite a big reach. And what we try to do is to find homegrown best practice models. We actually try them out. That's where my investment lies. I will take the risk, and if it works, which it usually does, I then present my findings to government and I say, okay, how can you incorporate this into your practice? Today, what used to be the midwife service scheme is now the Empower, the medical students part of the N-Power where young midwives and nurses are being paired with retired ones. They're being armed with these tablet things that help them to connect to each other so that we can get more health workers out to where they're needed. It's part of the 1 million health workers movement. So it can be quite funny to see where the global goals actually connect on a local level. And I'll give you another example. I actually felt that midwives can do a lot more than just delivering babies. So 22 months ago, I started a program called Mama Care, and I employed at the Wellbeing Foundation just 4 midwives spread between 3 states, Lagos State, Federal Capital Territory, and Kwara State, because I have this partiality to Kwara State. My husband comes from there. And they have been giving classes to pregnant women every week at a range of primary healthcare centers and secondary medical facilities. I think we have 31 locations now. We have reached 220,000 women in 22 months. And what we're finding is instead of the women just coming to the hospital, the target used to be 4 antenatal visits. Our mothers, our Mama Care mums, are actually coming every month. And the proof is in the pudding. Out of the 220,000 women in 31 medical facilities, we have not lost a single mother to death in childbirth.
You used an important word, and that's learning. And I think that the key, what makes philanthropy work, and what makes networks like the African Philanthropy Forum work, is that it's not just about giving, it's not just about collaborating, it's about sharing your learning so that each one is more impactful than the other. So if there's any other ethos that comes from APF, I know Wilson joins me in hoping that is one. Minister Werner, I do want to turn back to Liberia for a moment. And I want to do so because it's hard to work with philanthropists, collaborate effectively. It's like herding cats, all right? And there's a very interesting model in Liberia in which President Sirleaf established a philanthropy secretariat. And I remember there were philanthropists like George Soros and Pema Midyar who said to Madam Sirleaf, you shouldn't be spending your time with us, although we keep showing up and acting like you should. Instead, have a mechanism for that and spend your time with the people you want to spend your time with, and that's your citizens. Say something about the Secretariat.
So, recently I was in Silicon Valley, and I had gone to meet with philanthropists and to essentially explain what we're doing in Liberia. And they were surprised that a minister came to talk to them. And they were also thankful. I said that in the context of what was just said. I think establishing the Philanthropy Secretariat frees the president and it frees the minister to be able to look at the transformational agenda of the country and allow a trusted young person to manage the day-to-day contact and coordinate that contact. And I say trusted because I have found that philanthropists have a challenge with trusting government, right? And sometimes they follow individuals in government, not the whole government. So there has to be, we are lucky in Liberia to have a president that's had, so to speak, a foot in that world. She came through the UNDP and all of this and knows how these individuals behave. We're lucky because she has transferred that trust and credibility to some of us. And in turn, people she knows know us and they trust us. They do their own research. So the Philanthropy Secretariat has a good group of young people that manages all of this network of individuals with diverse needs on behalf of the presidency?
So, one of the other themes that have come up, particularly from Toyin Saraki, is the building the capacity of government in the process by sharing data. And here's an opportunity to collaborate with government so that you're not coming in with a program that is not aligned with the goals of the government. And that's why this example has been so powerful. Let me just turn to one other very dramatic example of where philanthropy could play a very powerful role on the continent. And I'm thinking of this just because the minister from Liberia is here and Nigerians are here. If you look back when the Ebola crisis happened, there wasn't the strong health ministry, health infrastructure that was needed to cope. And so something went from an outbreak to being a pandemic. What kept it from becoming a pandemic in Nigeria was that the combination of Aliko Dangote and Bill Gates and others that had built an effort here for the eradication, I don't think we needed all those extra syllables, eradication of polio, that Nigeria was able to repurpose those clinics, repurpose those health workers to deal with a different problem, and that was the problem of Ebola. So every investment you make has the potential of having far greater impact than even you imagine. And so I wanted to make that point because it's so powerful. I want to close with a final point. I advise a philanthropist in Silicon Valley who turned to me and said, you know, I don't have the time, I'm still running my company, I don't have the time to do what Bill Gates has done, so I'm going to have to take a pause in my philanthropy. I can't stop running my company, I can't do the day-to-day. And I remember turning to him to say, we don't all need to be Bill Gates. We can't all be Bill Gates. Well, we don't all need to be Aliko Dangote, although we can learn from both of those men. So I want to thank you so much for your forbearance with this panel. I want to welcome Ambassador Symington, who has joined us. And thank you for all that you do. And please thank our panelists.